Hello medicos, welcome to the official Handshake medical channel. I Kashki Dwivedi is here with you to guide you. Today I am going to deal with the very important component of the lymphatic system, that is the left lymphatic duct or the thoracic duct. So be with me from start to end to command the topic. So without any delay, let's begin. First of all, I would like to start with the component of the lymphatic system that include lymph, lymphatic vessels, lymphatic organs and the lymphatic cells. In lymphatic vessels, we study lymphatic capillaries, lymphatic vessels, lymphatic trunks and the lymphatic duct. And the lymphatic duct are of two types. One is the left lymphatic duct and the other one is the right lymphatic duct. And the left lymphatic duct is actually known as the thoracic duct, which is the topic of our today's discussion. So, proceed to the thoracic duct. We have already studied in the anatomical divisions of the body that a vertical imaginary line passing from the mid of the body. Focus on the cursor as I am moving. Vertical imaginary line passing from the mid of the body divides the body into two equal half parts, and the another horizontal imaginary line. Now the body is divided into four quadrants. Quad means four. So quarter or the 1/4. Body is divided into 1/4. Two quadrants present above the diaphragm, above the ribs, are the upper quadrants, and the quadrants present below to the diaphragm or the ribs is the lower quadrant. So this one will be the right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. So this right upper quadrant is actually drained by the right lymphatic duct, whereas whole of the body except the right upper quadrant is drained by the thoracic duct. So the thoracic duct is the largest lymphatic duct. As we are seeing, the thoracic duct is draining the maximum part of the body, leaving only right upper quadrant. Thoracic duct is draining the whole of the body. So the thoracic duct is the largest lymphatic duct. It is actually, thoracic duct is actually 18 inches or the 45 centimeter long, and it is about 0.5 centimeter wide. Now proceeding to next slide. Here this blue color region is the right upper quadrant, is drained by the right lymphatic duct, and this white color whole of the body except this blue color region is drained by the left lymphatic duct or the thoracic duct. Now origin or the source of the thoracic duct is from the cisterna chyli that is present in the upper abdomen at the level of the L1 and L2 vertebra and to the lower border of the T12 vertebra. From here, this cisterna chyli continue into the thoracic duct, reaches to the thorax. As the name suggests, thoracic duct present in the thorax, reaches the posterior mediastinum, superior mediastinum in thorax, then to the neck, and 2 to 3 centimeter above the clavicle it arches laterally to the jugular angle where it is terminates or end up. So we will see in detail in the next slide of course of the thoracic duct. Here I want to explain you that right lymphatic duct terminate or end up at the junction of the right internal jugular vein and the right subclavian vein. This is the right lymphatic duct draining or terminating at the union point of the right internal jugular vein and the right subclavian vein, whereas this thoracic duct or the left lymphatic duct is actually present posterior to the left internal jugular vein and end up or terminate at the union or the junction of the left internal jugular vein and the left subclavian vein. Now the course. Thoracic duct begin from the cisterna chyli that is present in the upper abdomen in front or anterior to the L1 and L2 vertebra. Actually vertebral column or the vertebral present behind or the posterior, and landmark for the cisterna chyli is the L1 and L2 vertebra level and the lower border of the T12 vertebra. So this is the cisterna chyli, and from cisterna chyli the thoracic duct originate or begin Actually, the thoracic duct is the continuation of the cisterna chyli in the thorax. So, from the lower border of the T12 vertebra, here lies the diaphragm, and now this cisterna chyli is to continue into the thoracic duct, means have to go to the thorax region. So it must have to pierce the diaphragm. Now the diaphragm, we have already studied in the openings of the diaphragm that there are the three openings, three major or the broad openings of the diaphragm, that are the first one aortic opening, second esophageal opening, and third one is the vena cava opening or the vena cava hiatus. Hiatus is the term used for opening. There in some book they mention the hiatus instead of openings. So from the aortic opening of the diaphragm, the cisterna chyli continue into the thoracic duct in the thorax region, and thorax region, first of all, it comes in the posterior mediastinum region in the thorax, and is present to the right. Here assume to the midline. Focus on the path of the cursor as I am moving. So this one is the midline. So actually this thoracic duct is present right of this midline in the thorax, in the posterior mediastinum region. Posterior mediastinum region is actually from the T4 vertebral level to the T12 vertebral level. Now this one is the site of the posterior mediastinum region. This much part of the thoracic duct is present in the posterior mediastinum region. Now the thoracic duct, also known as the left lymphatic duct, have to drain the lymph or the chyle from the left upper quadrant. So it must have to move to the left side. In the posterior mediastinum it is lying in the right side. Now it has to shift to the left side. So at the T5 vertebra level, this is the important landmark of the shifting of the thoracic duct from the right side to the left side. At the T5 vertebra level, actually the thoracic duct crosses the midline and moves to the left side. Now in the superior mediastinum means from the T1 vertebra level to the T4 vertebra level, the thoracic duct present left side of the midline, and this one is oesophagus. This one will be the right border oesophagus, this one left border of the oesophagus. So the thoracic duct in superior mediastinum, it is another important landmark that the thoracic duct in superior mediastinum is along the left border or the left edge of the oesophagus. Now in the neck, it arches laterally. Actually the thoracic duct in the neck is present 2-3 centimeter above the clavicle and at the transverse process of the C7 vertebra level. Actually at the root of the neck it present, and it then arches laterally, then goes downwards, and from posterior to the left internal jugular vein, reaches at the junction of the left internal jugular vein and the left subclavian vein, where it terminates or end up. So this one is the whole course of the thoracic duct. I have forgotten to show the anatomical position. So this one is the superior, this one is the inferior, this one is the right lateral, and this one is the left lateral. So consider this also. Now this is the 3D view again. So cisterna chyli present at this one is the L1 vertebral level, L2 vertebral level, and this one is the lower border of the T12 vertebra. From here the thoracic duct originates or begins, then continue to this posterior mediastinum in the thorax, then superior mediastinum in the thorax, then proceed to the neck at the transverse process of the C7 vertebral level or the root of the neck. It arches laterally, then goes downward and posterior to the left internal jugular vein and terminates or end up at the junction of the left internal jugular vein and the left subclavian vein, or we can say at the left jugular angle. So here you can find the very clear picture revealing the termination of the thoracic duct. So this one is the left internal jugular vein and this one is the left subclavian vein, and from here the thoracic duct is coming and it present posterior or behind the left internal jugular vein. You can clearly see here in picture, and at the jugular angle or at the junction or the union site of the left internal jugular vein and the left subclavian vein, it terminates or end up. Similarly, for the right lymphatic duct, this one is the right internal jugular vein and this one is the right subclavian vein, and this one is the right lymphatic duct. So it end up or terminate at the junction or the union site of the right internal jugular vein and the right subclavian vein, or at the right jugular angle. So this one is the termination. Now look at the area of drainage. It drains lymph or the chyle or the product of the fat digestion from both the half lower to the diaphragm, means from the right lower and the left lower quadrant, means from the upper abdomen and both the limbs, plus the lymph or chyle from the left upper quadrant, means from the left side of the head and neck, left thoracic wall, left chest wall, left side of heart, left upper limbs. One more important point about the thoracic duct is that the thoracic duct appears to be beaded in structure. As we clearly see in the picture, this thoracic duct reveals to be beaded in structure. This beaded appearance of the thoracic duct is due to the presence of the valves, and the presence of the valves is also very obvious because we have studied the thoracic duct is draining lymph or the chyle from the lower side of the body. It begins at the abdominal region, cisterna-chyli region, and terminates to the neck or the jugular angle. So it is draining lymph from the lower side of the body to the upper side of the body and is not supplied by any motor or any heart or any pulsating organ. Thus the reason for the presence of the valve is that it check or prevent the backflow or the regurgitation of the blood back to the lower side of the body again. Now the applied or the clinical. So the clinical is nothing but the actual what we have studied till now. We will apply these concepts to study clinicals or the applied anatomy. So obstruction of the thoracic duct, as the thoracic duct is draining the lymph or the chyle. So if there be any obstruction, maybe due to the mature filaria parasite, Wisteria bancrofti, or any other parasite, this infection of the parasite lead to the inflammation or the swelling of the thoracic duct that eventually leads to the bursting of the thoracic duct. Now the thoracic duct, when burst, the chyle or the product of the fat digestion flowing in the thoracic duct, as the thoracic duct is passing through the thorax, and when the thoracic duct is burst, the chyle flowing inside it reaches to the thorax region known as the chyle in thorax, known as chylothorax. Chylothorax means chyle in the thorax, and thoracic duct begin in the upper abdomen. So there lies the peritoneum. So when the chyle reaches to the peritoneum, causes chyloperitoneum, and likewise chyle in urine known as the chylouria. So chylothorax, chyloperitoneum, chylouria, this may occur due to the obstruction of the mature filaria parasite. This infection leads to the inflammation. Inflammation causes swelling, and swelling will eventually lead to the burst of the thoracic duct. That will cause this problem. Second clinical is that, as we have talked, that thoracic duct is present 2 to 3 cm above the clavicle at the transverse process of the root of the neck of the C7 vertebra. So at this site, actually during the block dissection of the neck, the thoracic duct is most prone to be injured or being damaged. Third clinical, as the thoracic duct is very thin walled and colorless, so during surgery in the posterior mediastinum, the thoracic duct is most prone, or there is higher chances rupture of the thoracic duct. So utmost care must be taken during surgery in the posterior mediastinum about the thoracic duct. As we have studied, the thoracic duct is present in the posterior mediastinum from the T4 vertebral level to the T12 vertebral level. So that's all about the thoracic duct. One small portion about the tributaries of the thoracic duct is left. I will create another video of that part. So that's all for this video. Thank you.